It's lunchtime, and if you're having your midday meal, be careful how much salt you're using, especially if you're a man. New research from the George Institute for Global Health shows that we're all eating too much salt, but the Institute wants to get that message through to men in particular. So it's warning of the adverse impact the resulting high blood pressure will have on their sex lives. Professor Bruce Neal is a senior director at the Institute.
So the idea today was to try and get men's attention. We know it's hard to get men to think about their health. We also know it's easy to get men to think about their sex lives. And that was why today we decided to highlight the link between high blood pressure levels, salt consumption and sex.
But a high salt diet is also bad for women as well as men, isn't it?
Oh, absolutely. High salt diets are a problem for the population as a whole. We're just today focusing on Salt Awareness Week, and the focus this year is on men and salt.
All right, so on average, how much salt are we eating and how much should we be eating?
So humans actually only require about a gram of salt a day for good health, and most people in Australia eat 5 to 10 times that level. So we really are eating hugely in excess of what we need.
And how much is that extra salt coming from processed foods, foods that we eat, and how much is coming from salt that we add to cooking, in the cooking process and then on the plate?
So one of the big challenges with trying to get people to eat less salt is that most of it's hidden. It comes in processed foods, in fast foods, and only about 10 or 15% of your daily salt consumption is salt that you actually add at the time of cooking or when you eat the food.
Now today you're announcing 85 what you call salt targets for foods. Which are the main culprits which are delivering the most salt to us in the diet?
The priority areas for us are products such as bread, breakfast cereals, processed meats, cheeses, which we know contribute the majority of salt to the average Australian diet.
Professor Bruce Neal, thank you.
My pleasure.